Andy, first of all, it's so good to see you, and I'm so thankful you're feeling better.
Thank you so much.
Dr. Reddy, thanks for joining us too, because people have a lot of questions, understandably so. So I want to get right to our viewer questions. Andy, somebody's asking about what medicines you took through all of this experience with COVID-19.
My doctor didn't give me any medicine. There's no treatment plan. She suggested taking Tylenol, drinking lots of fluids, and rest. That was pretty much it.
Dr. Reddy, we've heard this ibuprofen conversation. Where are we with all that?
Yeah, and still to this day, ibuprofen, a lot of that seems to have been sort of social media buzz. But, Andy, in the piece talks about taking Tylenol, and that's obviously a great fever reducer, pain reliever, safe for most people. I don't think ibuprofen is a bad thing. I think a lot of the stuff we're seeing is a bit of an urban myth. Having said that, only people that don't take baby aspirin and don't have kidney problems should take ibuprofen. I think whatever you normally take, should you get a headache or a fever, is what you should take right now. We've seen information change, but right now, no one is saying you cannot take ibuprofen.
Andy, some people were curious if you've had any other respiratory issues. Do you have asthma, severe allergies that might have contributed to all of this?
I don't have asthma, and thankfully, I didn't have any respiratory issues at all. The only symptom that came in about halfway through my experience was I lost my sense of smell, and I didn't notice it until someone asked me, because they had read that that was one of the symptoms. And to check on that, I brewed a cup of coffee, put it right underneath my nose, and I couldn't even smell it. So that was the only symptom that came on later in the experience.
Dr. Reddy, that's so interesting and really an important point, because as we have listed the symptoms from the CDC, having some respiratory issues has been such a marker people are to look for. And it's good to know that's not necessarily everybody's experience.
Yeah, and I think, that is important. The fever obviously is one of the main symptoms as well, and Andy did have that. But we are hearing more and more about the sense of smell, especially in people that were lacking some of the other symptoms. There are people who had no fever, no nothing, but just lost their sense of smell, and they were diagnosed with COVID-19. So I think with Andy's fever and that loss of the loss of sense of smell, that definitely was his symptom. I'm glad he didn't have the cough and the respiratory problems, because that's obviously where you get into trouble.
Andy, we've talked a few times through your experience. I know you were sick for about 10 days. You've been in quarantine for 14 and counting. Someone asked, have doctors said how long after you feel better can you get out of isolation? You have not left your apartment.
I haven't left my apartment yet. My doctor said that the CDC guidelines are as follows for someone getting out of quarantine that had the virus. You have to be symptom-free for 7 full days. And then after that, you have to go in and take a test. And then you have to take another test within 24 hours. And you have to wait for that test, both of those tests, to come back negative. And as you know, some of these test results are taking 5, 7 days, even longer. So those are the protocols I've been told to get out of quarantine. I just hope that I can find a test when I'm ready to take one.
Dr. Reddy, that is a long period of time, but that's the time frame that's important to make sure that the virus doesn't spread any further. I know Andy's been so conscientious, not wanting to spread this to anybody.
Yeah, and I think there are different sets of guidelines, but it's definitely one I've come across. And Andy's fear of spreading it, is a real one, right? Because what happens to you, you can handle. You don't want to feel responsible for somebody else, and that's what a lot of healthcare providers like myself are dealing with when we're coming home from being at the office or being at the hospital. We're taking a chance with our family, but that's what we have to do. So that sense of responsibility, I think we all take it very seriously.
Yeah, Andy, I know you've talked about that a lot. Andy, I think you're such an important example for everyone to see. You're young. I've joked with you forever that you are the most physically fit person I know. You've been extremely healthy, and that reinforces the message we've heard from doctors that nobody's immune.
Yeah, no one is immune to this. I, like you said, thought I took care of myself and paid attention to my body. So when I got this, I was very, very surprised. And I hope those watching that are younger and think that they're healthy can now take this seriously.
Dr. Reddy, how important is that message? It's not to scare anybody. I think it's just to empower people with the right decisions so that they can do what they need to, not just to protect themselves, but the people around them. And we see people still out and about quite a bit.
I think it's a very important message because, Andy is such a healthy young person, fit, et cetera. And I think that is part of why you've recovered, even though I know it was a terrible 10 days, you've recovered and, you should not have any long-term issues going forward. And that's what we all want to do. But I think that is a very important message that no one is immune and we have to help each other. And I think just as important as to how you've recovered is the fact that you have stayed in your house. You are doing what you need to do to protect the rest of us. And I thank you for that.
Dr. Reddy, thank you for your expertise. And Andy, I just want to say, I'm so glad you're feeling better. We love you. We miss you. And I really appreciate your courage to share your story with everybody.
Thank you, Cheryl. Thank you, Dr. Reddy. I can't wait to get out of quarantine and get out of the apartment.
Yeah, we look forward to seeing you all in person again whenever the time is right. Thanks to you both.
Bye.